Let's welcome our special guest and sponsor today, Bill Spratt, District Manager for Healthcare Solutions team. Bill, nice to have you on our show.
Thank you, Erica. It's a pleasure to be on your show. Here's to your health.
All right, Bill, I know I try to work out as much as I can, eat right, get enough sleep. What about you? Do you consider yourself a healthy person?
I am a very healthy person. I was never always this way, but I've worked out a lot more. I play some sports, and I generally keep a nutritious diet.
What is the average cost nowadays for an emergency room visit?
Their first 36-hour stay, you're going to run around a $40,000 tab. For most people, that's life-changing expense.
What percentage of today's population, Bill, have health insurance? How many people are approximately without it?
Approximately 90% of our population is insured, and the majority of the 10% that is not insured, or the over 30 million people, is those that cannot afford high-risk state-funded insurance because of the fact that they have many pre-existing conditions that make them uninsurable, or just simply those that are at the poverty level for income. And if they have an income qualifying level, they can also apply for Medicaid and therefore go on the state's All Kids program, which our former Governor Rod Blagojevich instituted during his term.
How will the new health care plan help turn this around?
The 2014 mandate is to insure everybody, not exclude any pre-existing conditions. What they do not tell you, however, is that an insurance company can rate up a given pre-existing condition as much as 800% over the original premium. The one nice thing about the health care bill is that now CEOs are limited to what they can make, and the ceiling on that is $500,000 in income a year. Also, what is also a benefit to the policyholder is that 80% of what is taken in premium now needs to be paid out in claim by law, which tops that by the previous 70% or a 10% increase. So if they cannot pay that out in claims, then they're going to be forced to rebate the policyholder in the form of checks.
How is one's health rate plan determined? What gauges are out there that will help evaluate the affordability of a health plan?
All right, to draw an analogy, Erica, with automobile insurance, demographics comes into play in a big way. If somebody is in an active zip code, meaning where a lot of claims have been filed, and even if the policyholder themselves has not filed a claim, their policy could still realize a significant rate increase due to the simple demographics of the area that they're in. If you're female 5'2" or male 5'5" and you're over 200 pounds, that's still going to rate up your policy because you're looked at as an additional threat, obesity threat, for heart problems later down the road.
I understand there's two ways of getting on a health care plan, individual or group. Could you tell us a little bit about both?
Individual plans are fully underwritten, so thereby if you're an individual that has a number of pre-existing conditions beyond blood pressure and cholesterol, then you're going to probably want to be with an employer that can provide a group plan, which in contrast is a pretty much automatic guarantee issue. Now, relative to the cost of the difference between the two, the individual plan is substantially cheaper, and here's why. The reason is because of the fact that since it is underwritten, there are conditions that can be excluded from coverage, and thereby it leaves the insurance company a lower liability of having to pay out claims for those conditions and allowing the price for the premium to remain low. With a group plan, all conditions have to be covered, including somebody that's in midterm pregnancy when they get on the policy. A lot more claims are paid out, therefore group plans can be as much as 2 to 3 times higher in rate than an individual plan. The advantages of an individual plan is that if somebody is terminated from the company and they're on an individual plan, they can take that plan with them and not have to prove insurability again and continue with the payments.
Well, Bill, thank you so much for being a guest and sponsor on our show.
Thank you, Erica. It's a pleasure to be on your show. Here's to your health.
Be sure to give him a call for your consultation. Mr. Spratt is located in Chicago. However, he does work with clients remotely. Here's to a healthy lifestyle.